online. It's really a pleasure to introduce our 4 speakers today. As many of you know, the Edwin S.H. Leong Center for Healthy Children was started based on a generous philanthropic donation from an alumnus of the University of Toronto, Dr. Edwin Leong, who lives and works in Hong Kong. And Astrid and I had the opportunity to visit Hong Kong recently, and also had the opportunity to make some connections with colleagues at Hong Kong University, at the University of Hong Kong, who are doing very interesting work, a lot of which intersects a lot with some of the things that the Leong Center is interested in, mainly addressing child health equity, understanding the well-being of children from the perspective of populations, harnessing interdisciplinary research, and really promoting the flourishing of children and youth. And there's a lot of really interesting shared learning. We had a really nice meeting today to talk about things that we can learn from each other's and ways we can collaborate together. And the idea of these rounds is to hear a little bit about some of the ways that these researchers and their colleagues are tackling many of the same issues we have here in a big urban place like Toronto, not as urban as Hong Kong, but an urban place like Toronto, as well as regionally, provincially, nationally, and globally. So we have 4 speakers today. I'm just going to, probably the simplest, I'll introduce the 4 of them at the beginning, and then they'll each come up and present. We'll have time at the end for question and answer. For those people who are online, please use the raise hand function, and Priscilla Medeiros is in the room and will be able to support moderation of questions at the end. So the 4 speakers are Professor Patrick Ip, who is a professor in the Department of Pediatrics and Adolescent Medicine at the University of Hong Kong. He's also a member of the International Scientific Advisory Committee of the Leong Center. Dr. Hing-Wai Seng is an assistant research officer in the Department of Pediatrics and Adolescent Medicine at University of Hong Kong. Dr. Keith Tung is a research assistant professor in the Department of Pediatrics and Adolescent Medicine at the University of Hong Kong. And last but certainly not least is Dr. Rosa Wong, who is an assistant professor in the Department of Special Education and Counseling at the Education University of Hong Kong. So I'll pass over to Dr. Ip, and really looking forward to your talk.
Thank you. Thanks so much for your very kind introduction. It is indeed our great pleasure to meeting you all good friends here, and of course having the luxury to joining all your work in Toronto and the Sikis in such a nice way. So we've enjoyed a very nice time in the past few days. So today I will making use of a short presentation section to share with you some of our work being conducted in a consortium, not just confined to Hong Kong, but also through our collaborative network in the region. So on behalf of our colleagues and their partners, I would like to share with you some of our evidence-based intervention tackling the child health challenges at the different stages through a life course approach. Now, as you probably realize, our children actually are developed under the context within their families, society, culture, and also the different time. Now, using the biopsychosocial model, we realize that actually there are different very important domains affecting health, affecting development of the children at the different stages. That's why many colleagues, including closely working colleagues from the different parts of the world, including those from Canada, obviously, that we have come up together and then discuss about the potential elements that is most crucial. Now, as you probably realize, health and nutrition are the very fundamental perspective of our children. Without good health or proper nutrition, no intervention would be effective. But on top of that, quality stimulation, tackling of the issues of the family poverty, and in particular modification of the family environment, including violence and all those child protection elements, are equally effective and important. Now, we understand child health and development in a more holistic way, including the physical health, like those problems that we encountered and just discussed recently on obesity, nutrition, the lifestyle issues, including the vision and the emerging problem affecting physical health, but equally important, mental health and well-being, in particular our main interest in ADHD, resilience, the mental health problems. We find it actually so challenging, in particular in the past few years. And the different domains of development, including the language, cognitive function, emotional maturity, and social competence, are actually the target that we have been focusing on all these years. Now, we would like to make use of a few just good examples, part of our work, to demonstrate how we tackle those issues through a life course approach. And to start the presentation, I will just share with you some of my experience, including a longitudinal cohort, like I just talked with some of the colleagues earlier, starting from using the Chinese format of the EDI, which you are very familiar with, and then follow up with a longitudinal cohort, now already into their teenagers. And then I will share some experience of our large-scale community-based intervention we call the Key Step Intervention Project, to see how it is effectively helping the families and the disadvantaged children. And during the COVID time, we have actually another big-scale study called Success, in order to using a scientific evidence-based intervention to improve the health and well-being of the children and the families during the COVID influence. And then our colleagues will subsequently supplement some of the very key elements that our team are working on. Now, many of you probably know Magdalena, and then we actually started a working relationship more than 10 years ago. Myself as a clinician and also a pediatrician looking after patients all along, but starting from around 12 to 13 years ago, I left one of the programs that I've pioneered because of the population rise already, and then joined the Hong Kong University as academic. Long after that, actually, we worked together, and then it's during the time when Magdalena visited Hong Kong, and then we start a new project using the Chinese validated EDI instrument in order to follow up the development and the health conditions of a representative cohort in Hong Kong. We recruit the cases from both the underprivileged areas as well as the most resourceful areas. You know, Hong Kong is a place very famous for its socio-economic disparity. Probably much worse than Canada to a certain extent. We have the most wealthy and most resourceful family in compared to the counterpart who are living in a very crowded and divided place, suffering from a lot of problems, in particular during the early childhood under the COVID influence. Now, in this longitudinal cohort, actually, we demonstrate at the very beginning, more than 10 years ago, the socioeconomic gradient affecting the school readiness of Chinese preschool children can be mediated through some very important family process, as well as the kindergarten environment. We actually, through a very stringent path analysis, we found around 55%, 1/3 of the factors that leading to why a lower STS families resulting in a lower school readiness children is related to the family interaction. Majority of them are related to quality of the parent-child interaction. Another 1/3, okay, is at the school level. Now, in Hong Kong, what our children facing to a certain extent to us is a double jeopardy. Parents coming from lower socioeconomic class, most of the time are busy working parents. They don't have too much insight on how to properly educate or control the use of the electronic device of young children. Most of them do not have very good quality parent-child interaction, but at the same time, they also have much lower chance of entering into good kindergartens with a stable teaching source, and the facilities and the equipment all along have been much underprivileged. Now, when Hong Kong parents are struggling, they try their very best to use much of their resources, network, training, in order to push their children into the best kindergarten, starting from 2 or even 3 years old, so that they are expecting they will move along the right track and then make sure that they're going into the best university afterwards. Now, what we are facing actually is a very special phenomenon. Actually, we have working with Professor James Hedman from U Chicago all along, testing about the potential factors that would be the most crucial determinant affecting the child development in Nongo. But in our longitudinal study, actually, we are able to prove even those household income, parental education levels, and the asset, of course, is important, okay? But when they compare with one another, actually, the most important single factor is the parent-child interactive activities, in particular, the recreational activity. For those children, even though they come from lower STS families, if they have good quality parent-child interactions, actually, this is the best predictive performance than other sources of STS on their long-term school readiness. Now, what we found is there are many factors at the very beginning that would affect the school readiness of our Chinese preschool children. Sleep duration is one of the key factors. Actually, our team have been heavily involved in collaborative studies of Shanghai and different parts of the world on how sleep affecting our children, not just the duration, and of course, also the quality. Now, Hong Kong children are well known, starting from preschool stage, they are much sleep deprived. Most of our middle class families, their children need to attend many different classes, a lot of training, and lower social class, they spend a lot of time on electronic devices. Usually the sleep pattern is quite unhealthy. Now, as you can tell, we actually have over 80% of our preschool children sleeping less than 8 hours every day. Okay, the expected is 11 to 12 hours every day for the preschool children. We almost demonstrate a very clear linear relationship between school readiness and then the sleep duration among our population. For those kids who are severely sleep deprived, sleeping less than 7 hours per day, their total EDI scores, their school readiness in general, have been much impaired, affecting the different domains in the holistic development, in particular, emotional, language, and cognitive domain. Now, proper management of the parents, particularly with a parental mediation of the use of electronic devices, for example, placing of the electronic devices not in the bedroom, actually have been proven to be very effective to minimize the harmful effect of the overuse of electronic devices. Now, at the same cohort, when they enter into a primary school, which is around 3 years later after the initial recruitment, actually what we demonstrate, no matter talking about Chinese language, mathematics, or other forms of school performance, you can tell actually the socio-economic gap have been widened. Even they are entering into the formal education. That's something that our educators do not believe, okay? Hong Kong is a very special place. Our government officials still claim education is the most effective way to balance or to narrow down the socioeconomic disparity. But what we found is actually the opposite direction. Now, we have actually followed up all those longitudinal performance of those children. Those children who have early exposure to sleep deprivation that I just mentioned to you in the kindergarten stage are those most risky cases, dropping into a lot of behavioral problems, in particular with a higher risk of ADHD. And all those sleep early prevention and then the modification would be the most effective way to minimize the risk of ADHD among our Chinese children. Now, what we found is that those potential ADHD cases, when they enter into primary school, is closely related to the sleep duration. For those who have actually satisfied the most healthy recommendation of 11 to 12 hours per night, actually the risk of ADHD when they enter into primary school are much lower after adjustment of other factors. Now, at the same goal, physical activities, doing sports, playing around among the preschool stage can also effectively reduce the ADHD risk and different sorts of behavioral problems when they enter into the middle childhood. And in the secondary phase, actually, I just pick up some of the things that we are doing. We are actually follow up the children for more than 10 years already. When they enter into secondary school, we do very detailed questionnaire and direct assessment in order to a better understanding about their health, development, and behavioral conditions. And as some of your colleagues know, we also have a detailed assessment about their vision development. They come to the Hong Kong Eye Hospital to examine their very detailed physical fitness as well as their vision. Now, what we found is that the parental involvement is one of the very critical factors affecting the general well-being of the kids, including their motor performance. Now, those coming from the lower socio-economic class families do have a much worse physical fitness and motor performance, seemingly mediated by the quality of the recreational parent-child activities, as well as the overuse of electronic devices. Now, I myself actually have joined the different WHO working group, focusing on some very key factors that we have just discussed earlier, including the very critical intensity of physical activity levels recommended every day, overuse of electronic devices, and very importantly, sleep quality and the duration. Now we know during the COVID time, actually, the lifestyles have been heavily affected and impaired in a different perspective. So that's why we are generating evidence of how it is being affected. Now, actually, in Hong Kong, we have conducted one of the first population study using a stratified random sampling to visit most of the primary schools in Hong Kong. Finally, we have recruited over 7,000 of subjects and followed them up to see how the overuse of electronic device and ADHD features are affecting our children. Now, in general, what we have observed is the overspending of time in using the different sorts of electronic devices, particularly in the gaming and also the different sorts of issues, have been strongly associated with the clinical as well as the research-based SWAN symptom score. Now, what we found over gaming during the early kindergarten stage, which is very common in Hong Kong, okay? But resulting in finally the behavioral disturbance, a lot of impairment in the different kinds of negative behavioral score in the strength and difficult questionnaire when they enter into the secondary school. We are talking about 8 to 9 years later. Okay? So the evidence is pretty strong. Now, what we found is the parental mediation or the overuse of electronic devices in the early stage actually is very helpful to improve and also reduce all those symptoms related to ADHD. And then parental guidance is one of the best way to minimize the adverse effect of video gaming of ADHD symptom at the very beginning. So we have also published the different articles, in particular focusing on the parents, as we briefly mentioned this morning, how the problematic overuse of electronic devices, distraction of parents would resulting in a much worse parent-child interaction, increase in the child's screen time, and also increase in child psychosocial problems among those underprivileged areas in Hong Kong. Now, being engaged in some of the earlier Lancet series, looking at the best nurturing environment, promoting early childhood development. Actually, we have published a series of articles in the Lancet a few years ago. Now, one of our key findings is comprehensive programs, including quality stimulation, health supplementation, and also a good parenting intervention would be the best way to support the cognitive development of our underprivileged children elsewhere in the world. Now, based on this concept, we actually have been motivated the resources from Hong Kong Job Kid Club to implement a large-scale community-based intervention called the Key Step HJC project. Okay, Key Step means the first step of our young children is so foundation as important to the whole society. Now, this is actually a large-scale community-based RCT. We have actually trying to tackle the issues of our young children at the preschool stage, starting from 3 years old, at the 2 most deprived districts in Hong Kong, inviting over 6,000 of children and their families in over 30 kindergarten to join, in order to build up a stronger foundation for their life outcome, strengthen the family functioning, develop quality learning environment, and also create some new community space to foster improvement in social competence. It is also one of the population-based studies using a data and evidence-based research to inform future policy. So we are hoping to improve the holistic support to health, improve the school learning environment, and particularly in families, we want to have a good nature or positive parenting intervention in order to empower the parents and improve their competence. Now, this is one of the early studies that we have conducted a few years ago, examining the effectiveness of those Key Step at JC parent-child interactive program on how they can, or if successfully, promote social emotional school readiness among our disadvantaged children. As I told you, this is a first RCT. So we randomized the group into both the intervention and then the health support group. This is basically using a well-structured, tailor-made program for Chinese population, a universal approach. Every kid in the district are eligible to join as far as the school partners. And some of them are high-risk cases, but most of them are healthy subjects. So the 20 sections of well-designed parent-child interactive program, including the crucial components of positive parenting, as well as the parent-child reading and the interactive activity that we have mentioned, and based on all those pilot experience that we have gained throughout all this year. Now, through this stringent RCT, basically, we have found a very promising result with a 3 years program, even override some of those COVID period. We find a significant improvement in the children's behavior, parents' use of emotional coaching, and also improvement in the involvement in the children's reading. For those who are interested, you are welcome actually to review some of our papers published earlier, including one of those in JAMA Paediatrics. We are actually examining how those effective multi-component parenting intervention could be beneficial to our children in Chinese community. And what we found, basically, we are using the Hong Kong ECDS, which is a direct assessment tool assessing the 11 domains of the holistic development of children. We almost find improvement in every domain of the holistic development throughout the examination period. Now, at the very beginning, actually, the intervention group somehow turned out to have a lower score than the control group. But throughout the intervention period in the subsequent 3 years, even with the implementation of all those COVID isolation measures, we find those intervention groups have been significantly improved, catching up. And for those who have more developmental problems to start with, actually, after joining the intervention, their progress has been much better than their counterpart. So we found among all those domains, school readiness is the most important domain that have been improved after joining the positive intervention. Now, those parenting intervention actually can also result in very significant improvement in reduction of the total difficulty score in SDQ and also improvement in their positive pro-social behavior. Now, with this experience, actually, we have established some new platform, which is called Key Step Hub, which is a very funny and beautiful parenting hub in the most deprived areas in Hong Kong. At the very beginning, it's only 2 districts, as you mentioned, in Tin Shui Wai and Sam Shui Po, the poorest area in Hong Kong. But in the past few years, because of the success and also the advocacy with all those community partners, we are now successfully moving into the phase 2 of the study. We are extending the study into 5 districts in Hong Kong, now involving more than 20,000 families in the different areas. So we are using a parenting approach, also our city design, in order to test the effectiveness of the different source of information. Now, during the COVID period, we have been commissioned by the government through a collaborative research fund, looking at how to deliver effective support to our children and families during the COVID pandemic. This is myself, because I'm actually working in the COVID ward at the very beginning. And at the same goal, we are actually visiting our children in the underprivileged areas, doing a lot of physical exercise and promotion. Basically, in this assess project, we have examined the impact of COVID-19 on the children and parents. We found actually a very alarming phenomenon, including the increase in the behavioral, emotional difficulties, overuse of electronic devices among our children, extremely high parental stress. Now, something which makes us even more worried, because the behavioral, emotional difficulties among those children, in particular those children in our cohort of special education needs, are particularly problematic. Now, for those kids with existing ADHD, autism, or different needs, no matter they are studying in special school or normal school, actually they are facing a lot of difficulties. Now, not to say just because of the disruption of the rehab training for the SDN children, but also they have faced a much higher risk of being physical abused or having child neglect during the academic. Hong Kong is one of the exceptional cities in the world that we have the longest period of stopping of physical schooling. You probably realize we have stopped physical schooling for almost 3 years. Which is, to me, is ridiculous. Okay, we have discussed with our government many times. Finally, we need to go to the chief executive to ask the education bureau not to do that anymore, because they should have the priority of letting the children to go back to school. Because physical schooling is so important, those online schooling is not effective at all among our children with SEN. Now, what we found actually during the cohort studies during the COVID, we also followed up our most underprivileged areas, and we have established another new cohort, which is we call the Hong Kong Children's Eye Study, which include a huge number of primary school students. Now, what we found in collaboration with our ophthalmologists is that the myopia incident have been very significantly increased, almost double. Not just the function, okay, but also the lengthening of the eyeball, which would resulting in very significant long-term consequence, including retinal detachment, macular degeneration, glaucoma, or even cataract in the longer run. Now, we also developed one of the AI platform using our AI system in compare with our nursing conventional counseling program, RCP program. Basically, we found a very promising result. The new AI platform is very useful during the COVID crisis in order to address the issues and the mental health needs of our parents in compare with the conventional nursing model. Now, I would hand over to Rosa to continue the presentation.
So Professor Yip just present some of our community work, and I will continue the presentation by focusing on the psychosocial aspect of our work in preventive child health care. So why is it important to apply psychological and social principles in preventive child health care? Because as you probably know, they can help us have a better understanding of children's behavior and their motivation. So for example, by applying psychological principles, we can detect early signs of developmental problems, and whereas the social principle highlight the effect of social and environmental factors on health outcomes. So we know that certain demographic factors can put children at a higher risk of developing health problems. And additionally, the social principle also emphasized the significance of certain social communication skills, such as active listening and also showing empathy, to enhance our ability to convey preventive information to parents and children. So by integrating all this knowledge, we can develop a more effective intervention to promote healthy behavior at an early stage. So next, I will present two of our recent studies that are related to preventive healthcare in Hong Kong. So the first study has been recently published in the Obesity Journal. This is a longitudinal study to examine the association between various child discipline methods and physical growth across the preschool years. So the reason for conducting this research is that because there has been a lack of research on the effect of child maltreatment on physical growth during childhood. As you may notice from the literature, most of the current literature in this area has been focusing on the adulthood outcomes. And furthermore, we know that genetic and environmental factors have a substantial influences on individual weight and height. But most of the current research, there has been limited research on the effect of early trauma exposure on physical growth. And there's also a knowledge gap in understanding the effect of multiple forms of maltreatment, because most of the existing research just focus on a single form of maltreatment, such as just the effect of physical maltreatment or sexual abuse. But they didn't consider the potential interaction effect among this type of maltreatment. So there's also some evidence suggesting that it could take some time, like 2 to 3 years, for adverse childhood experiences to have an impact on childhood obesity. So if the study just used a cross-sectional design, the effect may not be detectable, but the effect may show up in subsequent years. That's why we conduct a longitudinal study to examine this association. So what we did, we recruited 661 Chinese children from local kindergartens. And the longitudinal study involved 3 data collection time points, namely the first year, the second year, and the third year of preschool. So our research assistant would go to the kindergarten to measure the children's height and weight during each data collection time point. And additionally, the parents were asked to complete a questionnaire on demographic factors and child maltreatment at baseline. So the questionnaire we use is the parent-child conflict texture scale. For this questionnaire, maybe some of you are familiar with this scale. It has 27 items that can be categorized into 6 categories. But for this study, we did not consider the severe and very severe physical maltreatment, because cases under this category in our sample was very small. So we didn't consider these 2 scales. But for the other 4 subscale, we include all those data in our analysis. So here are the results. So as you can see here, the children being overweight or obesity, the percentage ranging from like 15 to 20% in our sample. Whereas for those who are underweight, is quite small number, so it's around 1 to 2%. So first of all, I will present the trend analysis result. So here is the trend analysis result. So the figure here is showing those experiencing physical maltreatment versus those without such experiences. So the this one here is showing the cases with physical maltreatment exposure. So as you can see here, they are consistently having a higher BMI set score than those without such experiences. For this figure here, the results are showing the psychological aggression, so which means the verbal aggression. So the figure here, as you can see, is showing an opposite direction. So for those having a psychological aggression experiences, they are consistently showing lower BMI set score than those without such experiences. So next, we also try to compare the result based on the types of maltreatment experiences. So similar to the trend analysis, for those only experiencing physical maltreatment at baseline, they show an increase in BMI score at the third year of preschool. Whereas for those having only psychological aggression and neglect experiences, they show a decrease in BMI score at the third year of preschool. But what is more interesting is the group with all three types of maltreatment. So based on our usual assumption or expectation, this group should be mostly or most negative impacted by the maltreatment experiences. But as you can see the graphic here, the change in BMI score at the third year of preschool was close to zero. So it seems that the children have not been influenced or affected at all. But actually, the reason may be suggesting that these three types of maltreatment experiences can interact to cancel out the effect of one another. Because for physical maltreatment, it can increase the BMI score, whereas the psychological aggression and neglect can lead to a decrease in BMI score. So when the child is experiencing all these three types of maltreatment together, there may be some interaction effect, and the effect would be cancelled out. So make the children look like they doesn't get any influences, but actually the influences may emerge in the future or in adulthood. So for this table, actually is addressing the time effect. So as you can see here, this is the only significant association we found between the child maltreatment event and childhood obesity status. And this significant association only appear in the third year of preschool. But this association did not show up in the first year or second year. So this is actually echo the existing research evidence suggesting that it takes some time for the adverse childhood experiences to have an impact on physical growth. So so that may be also the reason why many research are looking at the adulthood outcomes, because this is easier to detect the effect when the follow-up period is longer. But if we are trying to do more research in early childhood, then maybe it can suggest a better time for early intervention to reverse the potential negative consequences. So despite many strengths of this study, there's also some limitations. So this is a low-income sample, so the finding may not be applicable to higher income population. And there's also low data on the continuity of maltreatment and lifestyle behavior, so such as physical activities and also their dietary patterns. And furthermore, the parents self-complete the child maltreatment practice, so this can introduce reporting bias. The core take-home message include there's substantial BMI variation in response to different maltreatment types, and also certain types of maltreatment have delayed effects. So it is important to provide ongoing monitoring and support services to help those maltreated children to overcome the potential physical health consequences in the future years. Next, I will present another our recent study. So for this study, it is actually an intervention. So this is a intervention. We are trying to promote the children's safety knowledge and behavior for a mobile game called Safe City. So and this study has been recently published in the Journal of Medical Internet Research. So basically what we did is we are trying to develop a mobile game based on the principle of social learning and experiential gaming model. So these two theories actually suggest that we can learn by observing others and also experiencing the event in the virtual world. So because when we are in the virtual world, we can experience some dangerous event, but in a safe way. So we are trying to adopt this principle principle in our game. So in our mobile game, we incorporate many different game elements. So including like some eye-catching elements like effective graphic, some good sound system, and also some fun elements. And we also have a feedback and modeling techniques to facilitate an engaging learning process. So what we're trying to make the student to experience is that we hope that they can become aware of our game, and then they will develop an interest in our game. So they will play the game and continue to engage in the game. So we hope through having this engaging learning process, it can make some improvement in all these outcomes, including like better safety knowledge, better safety behavior, and perhaps also better psychosocial well-being. Okay, so this is some our game picture. So what we are trying to do in the game is the game will ask the student to take on the role of safety inspector, and the safety inspector would have to walk around the city and to check whether everything is safe. And so this is some way they can walk around the city. So for example, in this picture, the safety inspector is trying to cross the road in an inappropriate area. So there will be a warning signal here, reminding them to use the crosswalk instead of like trying to cross the road here. So and for this one is trying to teach the student how to use the traffic light. So for example, the inspector here is trying to cross the road on a white traffic light. So there will be a signal here asking them not to do so, and remind them we should cross the road only on a green traffic light. So this is some of the strategy we use in the game. And we also have some other mini games by gamifying the traditional questioning techniques. So for example, this is a spot the danger, and this is the matching mini game. And here is the multiple choice question. Okay, so to evaluate this intervention effectiveness, we decided a randomized control trial. And here's the result. And unfortunately, our intention to cheat analysis did not find any significant differences between the intervention group and the control group at the follow-ups. And this reflect the participation situation. But when we trying to do the usage analysis, we found some significant results. For example, the cumulative gain score was significantly associated with improvement in safe behavior and also the internalizing problem. And we also found some positive results specific to certain mini game performance. So, but this study definitely have some limitation because there's a very large variation in usage rate. And this is also not a high risk sample, meaning that most of the students in our sample have a relative high level of safety, behavior, and knowledge before the intervention. And the students self-complete the questionnaire, so this may introduce reporting biases. But there also the two important take-home messages is CVSM can actually benefit student mental health. So because most of the students are enjoying playing games, so when they can learn through digital games, they sometimes they will feel happier and also more excited about overall learning experiences. So another take-home message will be combining traditional teaching method with digital gaming features can be beneficial in enhancing learning motivation and acquisition of knowledge in preventive health education. So besides the safety intervention in the past year, our group also has developed other online preventive intervention that has been published in Pediatrics and Depression and Anxiety. So next, I will pass the floor to my colleague Keith to further elaborate on our work in nutrition.
So thank you. Today I'm going to share with you all about another cohort study conduct on vitamin D intake of some of the vulnerable populations. In fact, vitamin D has been identified as a key indicator to reflect the bone health and also risk to other physical activity or repeatable diseases. In particular, among infants and toddlers, we found that vitamin D deficiency could be associated with a wide range of different problems, including growth issues, skeletal deformities, and also adverse effect on the immune system or other brain development conditions. But despite on the health significance, the brain development, the prevalence of vitamin D deficiency remains very high around the world. So, but in local settings in our Hong Kong, we found that there's limited studies that have actually addressed this problem. Previous study conducted generally limited by the representativeness because of their own limitations. Therefore, in our studies, we want to have using a more population-based approach to address the below objective, including estimating the prevalence of vitamin D deficiency and insufficiency in Hong Kong among these three vulnerable populations, including the pregnant women, infants, and also young children. We also want to investigate in a comprehensive way on what different factors will in fact affect their vitamin D status. He showed a general region map of Hong Kong. We try to adopt a stratified sampling across different regions so that we can maximize our population representativeness of our sample. This is for the infant and toddler. We have one age recruitment center for the pregnant woman as well. Upon receiving the consent from the participant, the participant were asked to complete a very comprehensive questionnaire, including the supplementation practice, the sun exposure and behavior, the feeding practice for the babies, whether they are breastfeeding or mixed feed or formula feed. We also asked about the demographic data, including the age, sex parity, and also other anthropometric data. For the dietary assessment for 7 to 23 months of age, we use a 24-hour dietary record. All the participants will provide with a record form as shown here, although it is Chinese, and also a printed booklet for the record on the portion to estimation. All the data analyzed were then used to the food processor to analyze their dietary intake. And on the other hand, for the pregnant woman, we make use of electronic food frequency questionnaire that has been developed by our team. All the pregnant women were asked to report their quantity and frequency intake over 311 food items under 12 food groups. So this we also use an index called Dietary Quality Index International to assess the quality of their diet. So all these have been validated. We found it have good reliability and validity. This is an example of the EFFQ. On each of the items as shown on the left, all the participants were asked to report the frequency as well as the portion of each items that have been listed. And this is a relatively portion guide for them to look into. We also take the blood from them to measure the vitamin D status. In this study, we make use of the LCMS LCMS method, which have been validated and verified against external quality assessment. We found that we have a good satisfactory performance. In this study, we have recruited approximately 900 infants and toddlers, and we found that this figure, as shown here, is a vitamin D level against the age of the infant and toddler. We found that actually young infants are particularly vulnerable to vitamin deficiency with about 12%. We then have a comprehensive assessment on different factors, including the individual level, family level, or behavior, and also environmental level. And we make use of a wide series of regression analysis, and we found that actually there's 4 major significant factors, including the mode of feeding, the infant's age and sex, as well as the supplementation practices. But apart from this individual regression analysis, we want to further look into the particular group because we found that young infants, and particularly those being breastfeeded, has been the most vulnerable group to vitamin D deficiency and insufficiency. That's why we want to further look into what risk factor may have the interplay or other effect to contribute to this situation. We then make use of a cumulative risk approach, and we found that in fact there's a dose response observed. That is, if the babies are experiencing more number of risk factors, including, for example, maybe being a girl, low income family, they have mother with multiple pregnancy or many other offspring, low supplementation practice or routine application on the sunscreen or other factors, we found that there is a dramatic increase in the risk of vitamin D insufficiency. Thus, these results suggested that actually the occurrence of multiple risk factors is the main reason for the higher risk vitamin D insufficiency among the breastfeeding infants. So apart from the young infant, we also use a regression analysis, the same regression framework, to look into the factors affecting the dose is 7 to 23 months. We found that 3 significant factors, including the dietary intake, the supplementation practice, and also they are still being breastfed. But despite both dietary intake and supplementation practice have been long identified as a key factors affecting the vitamin D, as we can see here, actually over 80% of our subjects still consume less than the recommended dose, which is 400 IU per day. And for supplementation practice, actually only 13% have regular supplementation at the time of our visit. But apart from environment, we also want to look into genetic factor, because actually genetic influence is also being observed in various vitamin D metabolism. So we want to compare and see whether the contribution could be different. This is an overview of the vitamin D metabolism, and actually the genetic variation could influence the vitamin D status along the different metabolic pathway, including the vitamin D binding protein, which is responsible for the binding and also transport of vitamin D and its metabolite. The receptor of vitamin D, which is allow our body or our cells to respond to vitamin D, as well as other cytophones that can involve in the vitamin D conversion and activation. Based on the documented significance of vitamin D concentration, we have selected 8 different genetic variants in this study. So this table shows the preference of different genotypes, and actually is comparable to previous studies that have been conducted in the Han Chinese in Beijing. We then conduct a polygenic score based on the number of risk factors they have had and categorize into 4 groups, including the low, medium, high, and high, which is approximately evenly distributed into 4 groups. And our regression analysis found that there's a significant association between the genetic risk score and the vitamin D concentration. This is where if you are being into the high risk group, your vitamin D level will be lower. After that, we conduct a subgroup analysis to see whether the vitamin D supplementation practice as well as the dietary intake pattern could actually buffer or have any effect modification in this study. And we found that the negative impact of genetic risk score mainly observed among those without supplementation practice and those with insufficient intake. Our study. On the other hand, we also measured the vitamin D level of pregnant women. We recruit approximately 1,000 pregnant women and found that about 10% of them have insufficient vitamin D level. We also adopt a similar analysis framework to analyze a wide range of factors at different levels. But for this part of the regression, we found that mainly insufficient dietary intake is the key reason or dominant risk factor that affect the vitamin D status of pregnant women. We then further try to examine whether there's any interaction between dietary pattern and supplementation practice. And we found that by categorizing into 2 groups for both variables, for the dietary intake we categorize into adequate and inadequate group, and for supplementation practice we categorize based on the frequency from at least 1 time per week or less than 1 time per week. And in fact, we found that those with adequate dietary intake was more likely to have regular supplementation practices, mostly based on the higher, maybe they have more health awareness. And on the other hand, we also found that there's a greater responses to the vitamin D supplementation among those with inadequate intake. Probably so that supplementation could actually be buffering the negative impact of inadequate dietary intake. Apart from the baseline analysis, we also try to collect the copper sample from at delivery and found that the copper vitamin D level is actually very strongly correlated with the maternal vitamin D during pregnancy. And in fact, apart from, we are also trying to build into a birth cohort study of this. We are continuing to follow up on our birth cohort and expanding our birth cohort study. And currently, we have received around more than 2,000 copper samples, and we are following up to the age of 3 months. We are collecting some of the biological sample, including buccal swab, to further analysis on the DNA or other samples. And here are some take-home messages for this cohort. We found out that occurrence of multiple risk factors is the main reason for high vitamin D, insufficient risk for among those young infants. And we found out that both genetic and environmental factors could play a key role in determining the vitamin D level in infants. And have a sufficient intake on regular supplementation actually could buffer the negative impact of genetic factors. And currently, our team have been working with the government officials in Hong Kong to try to establish a guidelines and recommendation to ensure these vulnerable groups have sufficient intake in vitamin D. Finally, we found that maternal vitamin D level during pregnancy is highly correlated with the corporate vitamin D of their offspring. So we hope to conduct a longitudinal follow-up to see the outcome of infants with low corporate vitamin D and other outcomes. I will pass the presentation to my colleagues. Dr. Zhang.
So thank you again for coming and inviting me to have a brief presentations here. So for my part, I will just present some of my work during the COVID time. So it's still a little bit harsh on that time, but it should be a very good to understand the time. In fact, our group are always working closely related to the COVID time, to the governments, and also importantly, the vaccine efficacy in the children's, and also the important part is also related to the side effect of this kind of vaccine. So, it should be a little bit changed. Never mind that. In fact, nowadays over 30.6 billion doses of the vaccine have been administered worldwide. And with the mass scale of the vaccine have been administered in different countries. So the mRNA vaccine associated myocarditis was readily observed. So we conducted a study in Hong Kong at that time during the implement of the BioNTech in Hong Kong Adolescence. And it should be in 2021 June. So interestingly, we have epidemiological data shows that even much more high incidence of the acute myocarditis after receiving the mRNA vaccines when compared to the US data. But similarly, in our adolescents, we have more male will have this kind of side effect, and also after receiving the second dose of the vaccines. In fact, the exact pathogenic way to induce this kind of problem is still not understand, but it's widely speculated as a rapid amplified and prolonged inflammatory response of the host to the vaccine or its components. And in fact, we work closely with our group work closely with the governments, and we conduct some of the administrative work with the governments using the BioNTech. And after we reported there are some of the acute myocarditis cases, and some of the background of COVID case, and at that time is in fact Hong Kong is very, very good with very low local cases at that time before the Omicron comes. And even there are no death related to COVID vaccine, related to COVID infections. So at that time, we are trying to minimize the way to have this kind of side effect by using a single dose mRNA-19 COVID vaccine policy. So the adolescents will only need to receive 1 dose of the mRNA vaccine. But definitely there have been trade-off is most of the time they will miss the opportunity to get the benefit from the fully vaccinations. Unfortunately, the outbreak comes in 2022 in January with over, for example, like 75,000 infection cases per day in Hong Kong. So we need to review the way that single vaccine policy may not be adequately protecting our adolescents. But how we are trying to tackle this problem by extending the time that between receiving the dose of the vaccine, especially mRNA, in our Hong Kong populations. So we're trying to looking at it from 21 days and extend to 56 days. And after we assess, we go back and we assess the efficacy and also the risk. We found a lowered risk, especially in the male, here, and also there's also increase in the effectiveness of the protections, as we can observe a large reduction in the odds ratio of the infections at that time. However, it's still important to understand the basic mechanisms that related to the BioNTech vaccines, the side effect inducing a myocarditis. So we trying to conduct a study in understanding the mechanisms by forming a patient's cohort with 60 myocarditis patients. So these patients have been shown with abnormalities, for example, in the ECGs, in the echocardiogram, and also in the cardiac MRI. And importantly, there's also evaluate troponin T level during the acute time in the hospital. So also we have included 10 non-myocarditis control. So in fact, most of the suspected cases have been managed by our clinical department in Hong Kong. And after the assessment with the protocol here, they found it is not the myocarditis case, so it should be added as control. Another 10 healthy control, which is as a baseline activity of the measurements afterwards, have been included also. So 80 samples, biological samples, including their PBMCs, serums, have been collected during the time. And we assess them by looking at the inflammatory markers to assess their inflammation status, and also the cellular immune response by looking at the monocytes, NK cells, and T cells, which are capable to causing cellular damaging effects. So as expected, a generalized hypercytokinemia was observed in the patients. And interestingly, there are some of the cytokines have been shown specifically evaluate in the patients only, such as IL-1 beta, interferon gamma 2, and also IL-8. Although the generalized pattern seems to be messy, but in fact, we have closely looking at that is most of the cytokines are potentially pivotal to the activation of NK cells, such as IL-12, IL-18, and IL-23. And also these 3 specific evaluate cytokines, in fact, can also be contributing to the activation of co-stimulatory effect in the, for example, using the IL-1 beta with IL-12, we have a co-stimulatory effect to NK cells. So we then hypothesize and actually the vaccine with the myocarditis is actually an NK phenomenon. Then we just go back to the cryo-stored PBMC and try to immunotype those cells by looking at the activations subsets of the NK cells and also in the monocyte as well as the T cells. So we observed a extremely high activation level in the 57 positive NK subsets, but this kind of observation was not obtained in the monocytes as well as in the T cells. And importantly, this kind of activations was found to be positively correlated with the troponin T level in the patients. So these results can clearly making us that vaccine-mediated myocarditis is not a general hyperinflammatory effects in the host, but rather it is an NK-specific phenomenon. So after we getting the key information from the studies, so we're trying to answer the well-known epidemiological data we have. For example, we have a higher level was obtained in male, and also after receiving a second dose of the vaccines. So NK cells may play a central role in this kind of side effect, as well as it can be explanations for why worldwide as observed phenomenon after receiving the mRNA vaccines. As we all know that acute myocarditis is rare, but only affects certain subsets of populations after receiving the mRNA. So we hypothesize that genetics may play a role in this kind of inductions. So information of NK cells, we show for including information of NK cells. So we are looking at the KIR gene, the killer immunoglobulin receptor genes, which is a major determinant of the NK activity. So as we can observe, some of the risk allele have been observed and prevalence in the patients when compared to the controls. And interestingly, the 2DS3 KIR 2DS3 genes are exclusively observed in patients when compared to control. And from this analysis, we can observe a haplotype of KIR in this pattern. So this one, yes, here. And apart from that, we also looking at the potential mechanism of NK cells by including an analysis of some of the SNPs that previously have been identified in controlling the cytotoxicity of the NK cells. As we can see, these two SNPs have a more association to the troponin T level obtained in patients. So these two SNPs, in fact, controlling the expression of CD226, which is a co-stimulatory elements in NK cells, as well as a fucoxylase 11, fucoxylate transferase 11, which is a way to fucoxylate the NK cells. So the fucoxylate NK cells will show a more rigorous cytotoxicity and penetrate to the target organs more easier. So the important idea is we're trying to incorporate all this data. We will observe a genetic dose-dependent to the troponin T level in the patients. So this result also indicating that NK cell genetics controlling the NK cell activity will be a potential way to induce vaccine-related myocarditis. So this study have show a novel insight and also a very fundamental mechanisms that are reported in the COVID time and also here. And also this study can be a way to have improved version of the mRNA vaccine, as there's already newcomers may need to receive the COVID mRNA vaccine, as long as there may be more way to have a modified version of the vaccines. And also genetic data captured may be a way to have early advice for the genetically susceptible individual of this kind of before receiving of these vaccines. And some more detail can be obtained in my recently published paper in Cell Press. And yeah, and then with the improvement of the vitamin D, is a strong record of our team. So we are trying to look at if vitamin D can be a risk factor in mRNA related myocarditis. And in fact, vitamin D have been extensively researched during the COVID time. It has been linked to the COVID-19 severity, hospitalizations, and also mortality association. And also, vitamin D have been studied in the immunologies and also reactogenicity of the vaccines. have been linked. So vitamin D, in fact, having a direct inhibition of NK cell cytotoxicity in a dose-dependent manner. So we have hypothesized if vitamin D can be a way as a risk of vaccine-related myocarditis for the studies. So the same cohort applied for them, and we are trying to looking at if potential vitamin D is an inhibitory effect, as vitamin D also inhibitory functions in the immunity, always be anti-inflammatory. That's why we're trying to look at this cohort in this way. So from the first graph, in the A graph, in fact, we have observed a general hypovitaminosis D in the patient's populations. And also, so we will subgroup to look at the damage effect. In fact, there's a very huge cardiac damage was observed in the deficient or vitamin D deficient or insufficient patients. And if the fourth highest the troponin T level patients, in fact, they are all vitamin D insufficient. And also, the vitamin D have been associated to the presenting risk of some of the common known vaccine-related myocarditis symptoms, such as chest pain, and also the potential of admission to ICU. And interestingly, if the patients without, most of the patients, in fact, they didn't present the chest pain. In fact, they are having good vitamin D level. Just present by Dr. Hong now. In fact, vitamin D genetics controls vitamin D levels. So we just do an association to that, and we can observe the risk allele, the 7041A, have been identified related to vaccine-related myocarditis, and also as the isoform, the GC isoform, which is encoded by its haplotype of 7041 and 4588. In fact, the GC2 will also be a risk factor. Seems to be a GC1S to be a protective haplotype to that. So the vitamin genetics will control 25C level in the patients and will contribute to the risk of vaccine-related myocarditis. So going back to the assessment of the inflammatory level between different vitamin D status patients, and we can see that most, for example, like the vitamin D sensitive T cells response have been observed in patients with a higher level of the IL-6, which is anti-inflammatory cytokine, was observed in sufficient patients compared to the deficient or insufficient patients, and an acute higher inflammation was observed in the deficient patients. So importantly, just now we have observed some of the cytokines pivot for the NK cells have been highly evaluated in the patients. So vitamin D can seems to be modulate this kind of over evaluations by lowering the level. But some of the patterns have been observed, for example, like 18 and 23 IL, which is not in the list. So it is a way that vitamin D may act on specific cells, immune cells in the that will not specific group of the cells that will not be a general production alter the general production of the IL-18 and IL-23. And interestingly, we further looking at the NK cell activity. This time we're looking at the CD69. It is the early activation NK cell subset, and we can see a sufficient vitamin D levels. Patients will show a lower activations of NK cells, and also such kind of activity was found to be negatively correlated with the 25D level. So vitamin D was trying to have certain type effect on the NK cells also in the vaccinated myocarditis patients. So to conclude, in this part, the vitamin D genetics will contribute to the vitamin D levels and also inhibit the inflammatory of the induced in the patients, as well as the favorable NK cell activations. that further lead to the lowering the effect of the vaccine-related myocarditis. So we can speculate in that if genetically susceptible individuals, for example, like better to have inadequate sunshine, and also take a supplementation before or after the receiving this kind of vaccine may be a way to minimize the risk of this kind in developing this kind of side effect. And also, vitamin D may be acting just like the COVID-19 suggestions. In fact, vitamin D can be acted as an adjunctive medicine for the patients that are affected by vaccine-related myocarditis. So, this study have identified the vitamin D, NK cells, myocarditis access have been confirmed. So, the last part I will give you back to Professor.
That's why Keith and Rosa, for some sharing of the different projects, which we try to taking reference to some examples of how we approach the different domains of the physical and mental health in order to have a life course approach to guide all those interventions. So as you are so familiar, supporting and improving the health of our young generation is certainly a very challenging task. And we are still looking forward to collaborate with you closely in the coming years. Thank you.
Thank you. So I know we're a little over time, but I'm just blown away by the breadth of methodological approaches your group has put together, from cohorts to randomized controlled trials of very community-oriented interventions to understanding the biological underpinnings of really important population health issues. I know how big a deal vaccine-associated myocarditis was with vaccine hesitancy here, and I know that happened in Hong Kong as well. And it just blows my mind to think that something as simple as vitamin D supplementation may be able to mitigate that. So thank you for an outstanding presentation. Does anyone have any, maybe we have time for one or two questions? I know if people have other meetings, I understand. Do we have any, including from people online?
Nothing from those online, but I'll just check in with them.
I can ask one. Thank you very much. You went where you didn't have enough time to go through in a lot of detail, but I'm curious as to how in your sleep study, how did you isolate the effect of sleep among other components of socioeconomic determinants of health in your estimation of the effect of sleep?
Yeah, but that's a very good question. Indeed, you probably can realize it's a very difficult study methodology. There are so many confounding factors. So that's why we actually purposely consider a better approach of using longitudinal data with the more subjective reporting of those sleep duration and quality for a longer period of time. We're also using activities actually to monitor some of the duration and the sleep quality at the early period, and then follow up the subsequent well-being of the children when they enter into primary school and then secondary school. And on top of those findings, actually, I do not present, but actually I've co-supervised another PhD student with Shanghai Children's Medical Center. We're actually doing some experiment, using some interesting game to making the child sleep deprivation for a short period of time, and then see what would be the potential behavioral change. There are so many things that I think that there's worthwhile to work on further. But we grossly acknowledge all those limitations of some of the methodology as a cross-section study.
Last question, Catherine, and then if anyone wants, you guys are here for further questions after, right? You want me to be really covered?
So congratulations to the team, incredible research, and you've achieved. It's overwhelming to see what you've achieved. Thinking about the holistically as you presented all of those different health behaviors, what do you think is really promising sort of as a new area to investigate in terms of impact on child's health and development right now?
Actually, what we have, I just in my last part of our presentation, I have really recently have very heavily engaged with phase 2 of the Key Step project. So basically, lifestyle modification
Yes.
is some of the new intervention that we want to pursue. So difficult and challenging, but I think to rectify some of the deterioration in terms of deprivation, overuse of electronic devices, lacking exercise, and also nutritional imbalance would be one of the goals that we are trying to achieve as quickly as possible. We haven't got time to deal with that. Myself is also a member of the Advisory Committee on Mental Health in Hong Kong. What we are facing is a very alarming conditions. We have markedly increased, not just in child maltreatment, but also in suicide among our students. Yeah. So that's one of the factors that I believe having sufficient sleep and regular exercise would be one of the ways to go.
And on that note, on behalf of Sick Kids, Chess, Leong Center, thank you for the standing presentation. I'm going to bug each one of you with individual questions. Present it. Thank you.
And we are looking forward to more discussion and collaboration.